Namaste, myself Jivanshi Saxena, Faculty of Physiotherapy and Diagnostic, and my discipline is Medical Laboratory Technology from Jayoti Vidyapeeth Women's University, Jaipur. So, welcome in digital version 2.0. So, my today topic is HIV and AIDS. So, let's start my topic. Firstly, AIDS. So, AIDS full form is Acquired Immunodeficiency Syndrome and fatal illness caused by a retrovirus HIV. Okay, so it breaks down the body's immune system, leaving the patient vulnerable to a host of life-threatening opportunistic infection and neurological disorder of unusual malignancy. Okay, so the structure of HIV. This structure of HIV. Okay. So next, epidemiology. So epidemiology is of HIV. So males and more than males for females. Okay, and occurs in all ages and ethnic groups. All areas of the country are affected. AIDS is now the second leading causes of death for all men aged 25 to 44 years. So unintended injuries is has one and heart disease is has three for this age group. Okay, so HIV agents. So it is a RNA virus. Okay, so which replicate in actively dividing T4 lymphocytes and unique ability to destroy T4 helper cells and reversible once a person get infected virus remain in his body lifelong and the person is asymptomless carries for years before the symptoms actually appears. Okay, so source the virus is found is great concentrations is blood, CSF, and semen, and lower concentration have been found in tears, saliva, breast milk, urine, cervical, and vaginal secretions. Okay, also isolated from brain tissue, lymph nodes, bone marrow cells, and skin. However, only blood and semen are known to transmit the virus. Okay, so HIV is body fluid. So, average number of HIV particles in 1 ml of the of these body fluid. So, blood 18,000, semen 11,000, vaginal fluid 7,000, and amniotic fluid 4,000, and saliva 1%. Okay, so host. Age most cases are among sexually active people aged between age 20 to 49 years and high risk groups male homosexual, heterosexual partners, if drugs abuser, blood transfusion recipient, homophilics, and patient having STDs. So HIV transmission. HIV enters the bloodstream through open cuts, break the skin, mucous membrane, and direct injection. Okay, so route of transmission of HIV. So first, sexual contact, male to male, male to female, or vice versa, and female to female. Second, blood exposure. So infected drug use, needles sharing, and occupational exposure, transfusion of blood products, and perinatal, that means transmission from mother to baby breastfeeding. Okay. Next, occupational transmission. So, healthcare worker, hospital staff, and laboratory workers. Okay. Other routes: organ transplantation, artificial inseminations, and needle prick. Okay. Incubation period of AIDS. So, the incubation period is from HIV infection till development of AIDS. It is from a few months to 10 years or even more. Okay, so however, it is estimated that 75% of people infected with HIV will develop AIDS at the end of 10 years. Okay, so HIV infected T cells. So firstly, HIV virus, prone go on T cells, and then HIV infected T cells, and then new HIV virus, and last in both. Okay, so clinical manifestation. First, initial infection. Second, asymptomatic carrier state. Third, AIDS related complex, that means ARS, and fourth, AIDS. Okay, so firstly, initial infection. So except for a generally mild illness of fever, sore throats, and rash, which about 70% of people experience a few weeks after the initial infections, and most HIV infected people have no symptoms for the first 5 years. And however, they can infect others. So once infected, the pupil are infected for life. An antibody response usually takes 2 to 12 weeks to appear in the bloodstream. This period is called the window period. Okay, so test is negative. Okay. So the acute HIV symptoms follow 3 to 6 weeks following primary infection. So systematic may fever, weight loss, central, so measles, headache, and lymph nodes, so lymphodepathy, and pharyngitis, so mouth, so sore and thrush, and esophagus, so sores, and skin, so rash, and muscles, malaria, liver and spleen, and gastric nausea. So it is the symptoms of primary HIV. Okay, so asymptomatic carrier stage. So infected people with antibodies, but without any overt sign of the disease except persistent generalized lymphadenopathy. So it is, however, not firmly clear about how long does the asymptomatic stage last. Okay, AIDS-related complex. So has illnesses causes by damage to immune system, but without the opportunistic infection and cancers associated with AIDS. They are exhibit unexplained diarrhea lasting more than a month, and fatigue, malaise, loss of body weight, a fever, night sweats, and sign of mild infection like oral thrush, generalized lymphadenopathy, and enlarged skin. Common manifestation of AIDS. First, lung infection, so cranial pneumonia, and gastrointestinal infections, so candidiasis of mouth or esophagus, skin infection, so Kaposi sarcoma, and red or violet macules or papules, and central nervous system infections, so toxoplasmosis, dementia, meningitis, primary CNS lymphomas, and progressive multifocal and lipho is encephalopathy. And causes and contributors of HIV risk. So macro level, racism, stigma, poverty, gender equivalence, and migration. So three types of. So first is structure level, second community level, and third individual level. So first is structure level. Resource ability, physical, environmental, organizational systems, law, and policies. So individual susceptibility. And community level, so community norms, social networks, social capital, collective efficiency, and relationships. So individual susceptibility. And individual level, so behavior, attitudes, knowledge, and perceptions and biology. So individual knowledge. Okay, so prevention. Primary HIV prevention refers to activity focused on preventing uninfected people become becoming infected. So secondary, secondary HIV prevention aimed at enabling people with HIV to stay well. Example, testing to allow people to now their status, welfare rights, advice, life cycle, behavior, anti-discriminatory lobbying, and third, tertiary HIV prevention aimed to minimize the effects of ill health experienced by someone who is symptomatic with HIV disease. Okay, diagnosis of HIV. HIV antibody test using different antigen and or with different principle of the test. So viral antigen test used for screening blood donors in and detection of viral nucleic acid in blood, determine the CD4 count to assess the disease progression. Okay, testing ICTC center, that means integrated counseling and testing center. So district hospital and medical colleges. Free HIV testing, confidentially counseling, referral to nearest ART, that means antiretroviral therapy center. Antiretroviral drugs, NRTI, zidovudine, AZT, and lamivudine, 3TC, and stivudine, D40, and diamoxine, DDI, and tenofovir, TFE, V, and NRTI, nephropine, NPV, and sorry, NVP, and ephrazine, EFV, and interest habitors, and CCRT, anti and Marivroc. Okay, PV, PI, sorry, um, indiviors, IDV, and Retinovir, RTV, Lopinavir, LPV, and so available in India, available under national program. Okay, so prevention: avoid multiple partners, use condom, use sterile needle each time for injection, never share in needle, and avoid unnecessary blood transfusion. All pregnant women should be tested for HIV. Okay. Use standard work precautions, so hand hygiene, personal protective, and proper disposal of biomedical waste, immunization against HBV, and education. Okay. Occupational exposure (HCW) comes in contact with potentially infectious body fluid due to a precautionary injury, so like needle stick, cut with sharp object, and connect with mucous membrane, contact with non-intact skin. Okay. Management of exposure site. Do not panic. Skin, wash wound and surrounding with soap and water. Rinse well. Do not scrub. Do not use antiseptic or skin washes. Okay. And slips of blood and OPIM. So irrigation with water or saline. And if using contact lens, leave them in place where irritating. Remove once eye is clean. Remove them are clean. Mouth, state fluid immediately. Rinse mouth thoroughly with water and saline repeatedly, and do not use soap and disinfectant. Prescription. So contact art specialist and decision of starting PEP based on exposure type and HIV status of source. So decide PEP regimens. So basically regimens, two drug combination and extended regimen, that means 3 drug combination. Okay. So if source person is on our drugs, expert should be consulted after starting 2 drugs. Okay. Post-exposure prophylaxis. So in India, recommended for occupational exposure, it should be started as early as possible within 74 hours, and ARV is given for 4 weeks. HIV testing should be done at a baseline 6 weeks, 3 months, and 6 months. 3 months and 6 months. Okay, so HIV from being a virtual death sentence has been brought down to being a chronic manageable disease. Okay, so thank you so much. This session is completed, and any query in mention in comment box. So thank you so much and namaste.